Welcome back to Studio 701.
Now, when you go to the dentist, sometimes you can expect to get some x-rays.
We talk with Michaela from Polish Dental about the different kinds of x-rays and why they are so important to your dental health. Michaela Davidson is a dental hygienist at Polish Dental, and Michaela is joining us now. Thank you so much for being here today.
Yeah, thanks for having me back.
So there are some things you can expect every time you go to the dentist, like getting to see Michaela's smiling face,
Yep.
getting that free toothbrush.
Yep.
But sometimes there's a little extra you can expect at your visit. Talk to us about dental x-rays and why those are so important.
Yeah, so usually once a year, we'll take bite wing x-rays, which are 4 pictures so 2 on each side. They show us the in-between parts of the teeth. So on those, we're looking for areas that we can't see in the mouth. They're the small starts of cavities. We can see the bone support. We can see tartar buildup. It just kind of gives us a good picture of what's going on underneath the surface.
Okay, you mentioned bite wing.
Yes,
Is that what it's
so
called?
that's what they're called.
Okay.
Yep.
And there are different kinds of dental x-rays. What are some of the other kinds?
Yep, so the bite wing x-rays are mostly known as cavity detecting x-rays. There's another x-ray called a panoramic x-ray. That's one that's kind of a full scan, everything ear to ear, nose to chin. This is an example on the screen. So this is one in a pediatric patient. In kids, it's great because we're able to see kind of all of their permanent teeth, how everything is growing and developing. We are checking to see if they're missing any permanent teeth potentially. And as you get older, we use it more to, locate your wisdom teeth, see how those are possibly going to come in. And then once you've kind of had wisdom teeth taken out, we routinely take it every 5 years at our office. It checks for any cysts, tumors. We can see kind of the border of the sinus. Again, just giving us a really good view of everything kind of in the bone from what we can't see clinically just looking at you.
That's really interesting, seeing the permanent teeth versus baby teeth.
Yeah.
And my 5-year-old really wants to know how to lose a tooth because she really wants the tooth fairy to come. So if you have any tips on that, make sure you let me know.
I will.
Okay. Talking about, pediatric patients versus adults. Talk to us about the safety with these dental x-rays.
Yes, so everybody gets a little bit nervous, thinking about x-rays and radiation and first of all, with digital x-rays, the amount of radiation that you get is 80 to 90% less than with the traditional films like we used to use. So the radiation is really very, very minimal. You get more radiation spending an hour outside. And I think what we forget sometimes is there is radiation in tons of things that we're doing, right? So if we're watching TV, we're on our phones, there's actually, amounts of radiation in eating a banana. So you're getting it from all sorts of different sources, and with digital dental x-rays, we can get a localized picture of just that specific area that we want to see. It's not like if you're getting a chest x-ray and there's more exposure there. So the radiation really is very minimal. But on top of that, just as an extra precaution, we also use a lead apron with a thyroid collar. So it kind of goes around your neck and just really protects everything else from getting any sort of exposure.
And it's kind of like a weighted blanket. I mean,
exactly.
It just feels good. No?
Yeah.
All right. Anything else you'd like to let us know about dental x-rays?
Yeah, I think, if you have concerns about, maybe past medical conditions that you've had, cancer, radiation, things like that, always just visit with your provider. They're going to be the one to say, you're really low risk. Maybe instead of doing them every year, let's do them every 2 years. But then on the flip side, if you are more high risk for getting decay, it's great to take them once a year because the sooner that we catch these things, and with digital technology, we are able to see things so much sooner than we could on the traditional film x-rays to say, hey, you have this area, it's starting to look a little bit shadowed, floss it really well, and we'll check it again on your next x-ray. So, I think that they're really beneficial in catching things and kind of keeping dentistry more preventative rather than let it go till you have this huge cavity that's kind of, bombed out and hurting you now.
Right. Some great advice there.
Yeah.
Thank you so much, Michaela.
Absolutely. Thanks for having me.
And Polish Dental is located in Bismarck and accepting new patients now. They utilize state-of-the-art technology with dental care and create personalized treatment plans for their patients' individual needs. To schedule an appointment, you can call them at 701-222-4746. That is 222-GRIN.